Good evening, everyone. Hope everyone's doing all right. Thank you for joining us. Thank you for joining us. It's a beautiful Tuesday evening here. It's Tuesday. You know what that means. It's time for change, matter, solution. We do each here. It's 7 o'clock here in Dallas, 8 o'clock on the East Coast, and 5 o'clock on the West Coast. You're in the Mountain Time Zone. Hey, you do the math. Got another great show lined up for you. Actually, we have a special show this evening. I'm going to let my host let Williams tell you about that. But stick and stay and don't go away. And remember, tell a neighbor, tell a friend about the change movement. Hendrix.
Good afternoon. Good afternoon. It is a Tuesday right here on the Intentional Talk Radio Network. We are going to get this started. We are bringing you, it's time to tell the truth. The Delta variant, the vaccine, should I or shouldn't I? And we know what's going on in the communities right now. Should I or shouldn't I? We're going to help you make a decision. Should I or shouldn't I get vaccinated? We're going to help you make a decision. And by the end of this broadcast, I hope that you have gotten enough information to make a conscious decision. We've got world-renowned doctors with us this evening. We've got Dr. Richard Harris. We've got Dr. Sylvia Gates Carlisle. We've got Dr. Godwin Orkay. We've got several doctors who will be joining us. We have a holistic doctor, Dr. Debbie M. Booker King. We've got Dr. Zareed, who's a naturopathic doctor. We've got Dr. Doug Harrington, who will be joining us. So if you have any intrepidation, if you are confused, if you don't know who to believe, if you're
make sure your monitor
if you're leaning towards Facebook, we're going to help you not lean towards Facebook. We want you to make a decision about your health. And that's why we're doing this show. It's very, 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 very important. We don't want you to use Facebook and Twitter as your professional messages. We want you to use the science. And these professionals come with the science. So join us right here on the Intentional Talk Radio Network. Join us on all of your podcast platforms. And please don't allow the Lieutenant Governor in the great state of Texas to make that valid. He said something so egregious. And I know that you all know what he said. He said that this is a political issue and that Black people are the reason the surge is where it is. So we're not going to we can't give that any gas. We cannot give that any gas. So we are going to get started. Dr. Douglas Harrington is with us. Dr. Fareed Zarif is with us, and we are going to get started because this will be a lengthy show. We're going to talk to you about the vaccine, the Delta variant, being healthy. So let's get started. And we are going to get started with Reverend Marcus Banks Bay, who will open up the show. Thank you very much, Marcus.
And thank you. I appreciate that introduction. I appreciate everyone being here, being present. It takes a lot for that presence because it's knowing that everybody has something going on. We're all being affected in this day and time. So with that in mind, however, you all may approach and receive the Spirit, let's do that with the Heavenly Creator in mind. Heavenly Creator, Most High God, we come before you today with your blessing, with your grace, with your presence in heart, spirit, and mind to say thank you for your divine breath, for your divine works, and knowing that we are protected, we are saved, we are present with you, and knowing that you are the one who has always been here within and without, whether seen, whether unseen. We know that through your divine spirit, grace and glory, that we can bring about your works. And through those works, we can manifest all great ideas and all divine manifestations. And so through these divine manifestations, we can bring about the presentations and overcoming of everything that is being brought forth today, to include the Delta variant, to include COVID. We know that this is just a time of trials, and these trials are just a test, and in testing our spirits, we know that we can overcome these roadblocks and barriers with our perseverance, and with that, you are protecting us. And so with these thoughts, these prayers, and with this divine, even patience in mind, we pray all of these things in your most glorious name, in the name of your willing Son. And in those various names, whether that be Jesus, Yahshua, the Messiah, and Mashiach, because we know that your Christ has come in various different forms. We are here to pray in those tongues in your heavenly name. Amen.
Amen, amen, and amen. I want to start by saying, I guess most of you who know me, you know I'm a talker. So I talk all the time, not only on this broadcast, but I talk all the time. I'm always on the phone. And anyone that knows me, they know I'm on the phone. Well, can you take a wild guess as to what the conversation is about 24/7? Can anybody guess?
Our new reality.
Yes, that's what the conversation is all about. Yes, I'd rather not. I'd rather talk about the things that my granddaughter says that are just incredible. I'd rather talk about turning 69 on Monday, Labor Day weekend. I can't even have a party. And I probably won't be able to have a party next year when I turn 70. I'm pissed off. That is not how it's supposed to go. I probably won't be able to celebrate 70 years out of high school. Our 70th class reunion will not be realized because of this. Every day we're talking about this. It doesn't seem to get any better. If it's not the schools, it's the hospitals. If it's not the hospitals, it's the schools. The schools are ravaged. We all knew that when they opened the country, June 15th, that was not good timing. That was not good timing at all. When you tell folks who have no control anyway, no self-control anyway, go out and have a good time because we're getting there. We're going to reach herd immunity by August. When you run out and tell folks who were not taking care of themselves in the beginning, who were still running out to McDonald's, who were still running out there doing the same thing they've always done, and you then tell them they can take off their masks. That was worse than telling women they can burn their bras. Come on, people. Really? Really? Kids are going to school, coming home, talking about who in the classroom has tested positive. That's not what I want my 9-year-old granddaughter to come home with. But she is. She is. So what are we doing or not? And the people that are running around the country without a mask on, at least, what are you not thinking. And I agree. I agree wholeheartedly. If you were on the planet Uranus and you wanted to do it your way, then have it your way. This is not Uranus, and we are all in this together. Doctors have never worked so hard. This is not what the doctors took the Hippocratic Oath for. This is not why teachers took the very same oath. Come on. Really, people? We've got to do better. We've got to do better. If you don't want to take the vaccination, please don't listen to Facebook. Don't listen to Twitter. Don't listen to social media. Don't get your information from social media. I can promise you, they ain't right. The theories, please don't listen to the theories. The theories are simply that. It's a theory. They don't have the information. And I ask you, and I've asked this question before. Who should we listen to? Who is right? The 8 doctors that we have on this broadcast, or the 8 folks on Facebook? Who is right? And for my money, which ain't much, I'm going with the science. I'm going with the doctors. I'm not going with Facebook. I don't like Facebook. I'm going with the doctors. We've got to get this under control. We've got to get this under control.
Colette?
So let's get started.
Can
You're breaking up a great deal.
am I breaking up really bad? Okay. I just wanted to play a 60-second clip before you get started, just to talk about where we came from and how we got
Yes.
here. This thing should have been done with this. I just want to
Okay.
play 60 seconds. so you can
Okay,
put this
please
in
go.
place.
Yes, please play it. Hasn't come on yet. No, we can't hear it. Cannot hear
Okay.
it.
Okay. That's
Okay,
fine.
let's get started. And then when you can get that working, we'll come back to it. Let's get started. And my first doctor is Dr. Sylvia Gates Carlisle, who practices in Los Angeles. Dr. Carlisle, I believe, is an emergency room physician, right, Dr. Carlisle?
No, I'm an internist and geriatrician.
Internist.
But that's okay.
Internist. All right, great. Thank you. Then next we have Dr. Godwin Orkay, who is one of our highly respected COVID physicians who works in many areas in Los Angeles, as does Dr. Carlisle with this COVID-19. Every doctor that we have on the panel has worked tirelessly in this pandemic. So the information that we're going to disseminate this evening, this is what you can take to the bank, not Facebook or Twitter. This is what you can take to the bank. We have Dr. Douglas Harrington, who's with us also from the Orange County area. Dr. Harrington has worked endless hours with the antibody testing. Dr. Harrington is a cardiologist in Orange County, and Dr. Harrington is doing great things with the antibody testing. He's educating the community on why we need the antibodies and what is necessary with the antibodies. We have Dr. Richard Harris, who is an emergency room physician. Dr. Harris is in, I believe, Houston. Correct, doctor?
Yeah, I'm in Houston, but I'm an internist as well.
An internist, great. Next, we have Dr. Zarif, who's in Los Angeles, who is a ND. And for those of you who don't know what ND is, stay tuned. He's a naturopathic doctor. And he too is working tirelessly to get people to understand if you're not going to take the vaccination because of your theories, then at least be healthy. At least be healthy, and he can help you get there. So let's get started. I am going to present the questions. We have a co-moderator who is also Mr. Rodney Northern, and he's going to also be asking questions, and we're going to get this going. We're going to get down to brass tacks. So let's get started. Dr. Carlisle, my first question to you. What's going on? Why are we still in this? And you and I had a very long conversation about this. What is going on?
Well, I think number one, we have a novel virus. Coronavirus was discovered in 2019, so it's a new virus. So knowledge is evolving on a weekly, daily basis, and I'm sure all my professional colleagues can talk about how the research, we're learning as we go. We are driving on the freeway while building it. But with 600,000 dead Americans, we don't really have the luxury for the level of evidence and experimentation that we would like. We're trying to save lives now to the best of our ability. And maybe in 2 years, we'll have a different understanding of ground reality, but we're doing the best we can because the novel virus is a significant threat to Americans. US life expectancy dropped as a result of this virus. And we are the country with the most resources in medicine and healthcare of any other country on the planet. We spend 40% more than anybody else. And so if we're having a crisis, it is a crisis. So we need to be educated and activated and discerning. And so when I see some of the ignorance that's spread, the lesson is everybody with a platform does not have an informed opinion. Can I get some clapping in the background for that one? Stand up, y'all. So, everybody with a platform does not have an informed opinion.
Right.
Some people are spreading absolute misinformation. And when we talk about the word out from Texas that Black people are the problem, I beg to differ.
Yeah.
The studies show that the most resistant population is the folks who believed our past president that COVID would only be as bad as the flu. A bad flu season is only 60,000 dead people in a year.
Mm-hmm.
We're way beyond that. So
yes,
those are the people, yes, white Republicans are the people least likely to get immunized because they don't believe in evidence. They're listening to talking heads, talking empty heads. But we want people to be educated and activated to protect themselves because a lot of information in the universe is misinformation.
Right, right. Well, we've got a lot of misinformation that's going on out there. We've got a lot of misinformation, and it's too bad because people are listening to the theories. They're listening to the stuff on social media. And I'm telling you, and I hear it every day. I hear it every day. Well, I heard it on, I saw somebody who is, they know what they're talking about because they got it off of Facebook, but they got it off. No. Have you seen what's on Facebook and you think that that's something that you should risk your life for? Whatever came on Facebook? No, I don't think so. I do not think so. And we're missing the mark. Kids are now infected. I'm hearing astronomical numbers about kids who are being impacted by this. And I'm afraid for my granddaughter to go to school. I'm afraid for my granddaughter to go to school. My former husband went on a rampage, and I mean on a rampage. I still hear it in my ear because of folks who are not vaccinated. And I had to tell him to stop screaming. Stop screaming. I have to scream. I have to scream. Okay, this is getting out of hand. This is getting out of hand. The first week of school, Los Angeles Unified had 3,000 positive cases. The first week of school. The second week of school, LA Unified had 3,500 positive cases. People, come on. There was one classroom, Hollywood Elementary School, had 11 cases in one class. 11 cases. School districts are losing staff and students. I was in a meeting today. LA County is asking a question. Why are you losing kids? Why are you not recruiting? Where are you been? Don't you see and hear what we see and hear? How come you're asking a question like that? Because it's about money. So we're not going to have that conversation because I think we all know a lot of it's about money. Can't be about money and it cannot be about politics. We'll never get out of this. We will never get out of this. Dr. Orkay, tell us about the coronavirus, the SARS-CoV-2. Tell us about what happened in 2019 and where this went and where it didn't go. Because we're follicle deep in it.
Yes. I just would like to continue from where my respected colleague spoke about driving on the freeway while we are actually building that same freeway. Unfortunately, that is an analogy that just aptly captures what this situation we are facing. Beyond with the numbers Kenny has already put on the screen there, we are looking at more than 500,000 there. That is just in the United States alone. Just the US, where we are spending 17.4% of our GDP on healthcare, higher than any of the OECD countries. Yet we should ask ourselves, where's the value for the money? What happened? Let us discuss those numbers for a minute. You gave us statistics, real life statistics right now, where you are telling us that in LA Unified School District, from testing alone, they got X number of children positive in the classrooms, and we have schools being shut down right now, classes by classes in a staggered approach. Just last year, what were we told? That if you test, then you become positive. So there was so much effort against our testing so that we don't find a high case detection rate or a positive score index. In other words, let's just hide our head in the sun like an ostrich and wish it away because it's just like a bad cold. Fortunately, that cold is yet to run its course. If anything, with the Delta variant now, it is building. You may ask, and a few people have asked me, why did we use Delta variant? How did we arrive at Delta? It is very simple. Remember, somebody had called it the Kung Fu virus. You remember somebody had called it Wuhan virus. You remember we are doing scapegoating, blaming everyone else but us. And when the World Health Organization thought of using a nomenclature that would be neutral, and knowing that it's the fight of the fittest, everybody needs to survive. Even the virus needs to survive. The virus is adapting, mutating to all our tricks and antics. So going back from the zero, then we started with alpha, beta, not as bad, beta and Charlie, and now we have delta, but it is not the end. Before we know it, it will be called the Beijing virus. We don't want it to be called the Beijing virus so that we don't start attacking the Chinese and the Asian minorities in our polity as part of the antics of scapegoating. But the scapegoating is not over. In the lieutenant governor in Texas, the good state of Texas now think it's the black folks. The Republican parties, unfortunately, think it's because we've not secured the border enough and we have the migrants coming in. But the SARS-CoV-2 virus does not need a visa, does not even need our permission to come in. It just comes in. And now we are running out of scapegoats who will think President Joe Biden did a horrible job at the withdrawal, which needed to happen. So we are going to blame the Afghans soon. Mark my words. We'll be afraid. Fear will be instilled in the people. So you can say we cannot view this virus in isolation. And as Dr. Kalia said, she actually talked about the misinformation, but she was very kind. It's not misinformation, it's disinformation, which is a deliberate act to mislead for your own purpose or your own objective, not for the common good. It's a deliberate act. You know the truth. Yesterday, Miss Colette and I spoke, and she said, "Hey, Doc G, what will you talk about?" I said, instead of talking about the COVID, I'm going to talk about the great challenge. How on earth are people standing on those crates, break their limbs, risking their lives, their necks, permanent disability? For what purpose? Because somebody did it, it became viral. So for once, I'm going to disagree with Yolanda today, because she said, let us leave Facebook. Let's not get our education from University of Facebook or the College of Google again. This is where the information is. Today we are live streaming it on YouTube. Some people are being educated right now. So let us now pick that challenge and give a counter narrative and meet them where they are. A few months ago, I was on this same show when my daughter, I gave the story of my daughter who told me I was overdoing it when I was brushing my teeth and rinsing my mouth clearly. And she said, "Daddy, what are you doing?" And I said, "Just brush, rinsing, to go." He said, "No, that I should leave some of the toothpaste on my teeth." And I asked her why. She said, "Because if you keep on walking and cleaning it." And I said, "Who told you that?" And she said, "She's 9. I found out on Facebook or Google, or YouTube or something." And I said, "What? I went to medical school. You are 9. I'm paying your internet bill, but you're telling me not to brush my teeth, and you believe it." Now, let us flip that story now. And let's just imagine she actually has good information, which is not there. That is why in this debate, I don't think our approach will be to convince people about efficacy, efficiency, safety, or the reality of this virus. I think we'll go way beyond that point. In my personal opinion, I really do think that it's time to talk about responding to their concerns, because really the only dumb question is a question that is not asked. So we have to create an enabling environment, from getting Dr. Harris to give us one of his moves on TikTok to any other thing, just to get their attention and talk to them, because we have the conflicting priorities coming on. Let us pick one last example before I give back the microphone. Operation Warp Speed. My respected colleagues here know that was successful. President Donald Trump, the federal government, bust their ass to get this vaccine out. And yet, they are running away from owning it. A process.
Oh, you're on mute.
A process that should have taken 6 to 10 years. They got it out in under a year, 9 to 11 months, with testing and everything. We got the EUA, the emergency use authorization, out. Why can they not own it? This is a success story that shows collaboration, interagency, multi-agency. There's no conspiracy in that. This is success story. Why are we shying away from it?
Thank you, Dr. Orkay. Thank you so much. Nobody has an answer to that. And as I say constantly, I don't think anybody was just running to get the vaccination. I don't do needles. I do not do needles. The last time I got a vaccination, I believe it was 60 years ago. 60 years ago. And back then they gave us a sugar cube. We walked to the school. We got the sugar cube. We stood in line. Everybody got the sugar cube. We were gone. It was okay. Nobody complained about the sugar cube. Nobody asked at that time about what was in the sugar cube. We knew what was in the sugar cube. It was a vaccination. It was pink. We were going to suck on that thing until it was dissolved and okay. And we were fine. We were fine. And I understand things are very different now. Things are extremely different. That's why we have Dr. Harrington here. That's why we have Dr. Zarif here. That's why we have Dr. Harris here. Things are very different. And people have varying ideas and people have varying opinions. But can we afford the different ideas and opinions right now? Dr. Harrington, can we?
I don't
And
think
then we're
so.
going to go to Dr. Zarif.
Yeah. Well, first of all, I agree. I think that, sorry, just a second. I'm being paged here.
It's okay.
That was my wife. She's the boss, so I have to give her the car keys. I think the comments have been right on and very perceptive, and they highlight what's been the most frustrating thing, which you've talked about Facebook, you've talked about Instagram. What you haven't talked about is the scientific literature where there has been disinformation as well. And it's even more frustrating because these are supposed to be independent, unbiased sorts of things. And because of that, there's been a lot of garbage that gets published, and it confuses the frontline doctors. And there's a real disparity between people like Dr. Carlisle, or people who are treating patients in the front line versus the academic groups, which are thinking about things, and I just had to write a chapter on COVID for a cardiology book. And the first message I got, I refused because they said, we're going to dictate to you what you can say and what you can't say. And I said, no, we're just going to take the science that we know that's solid now and use that information. So, not only do we test people, we also treat people. And I will tell you that what we're doing, the Regeneron antibody cocktail has kept most of our patients out of the hospital. It's a stopgap. It's not as good as vaccinating people, but if you've got people that don't get vaccinated, it's like a 94% efficacy. That's pretty rock solid data. The other thing is there's an old antidepressant called fluvoxamine, and it is actually working some miracles in the hospital, keeping people out of the ICU and off respirators. It keeps their O2 sat up. And so I think there's some things that just aren't being disseminated, but here's a little data that's really frustrating. Do you know who the group is that refuses vaccines more than anybody right now? What would you guess?
I would guess the millennials.
No, it's nurses. There's huge battles going on in various places. And
Yes.
I don't understand completely, but these are healthcare professionals. And like you, I'm allergic to eggs and chicken, which just breaks my heart because there's nothing I like better than fried chicken, but I can't eat it. So, and most of the vaccines were cultured on eggs, so I couldn't get them. But I travel a lot. I'm out of the country a lot, and sometimes they make you get them. There is a precedent for requiring vaccinations for lots of things. It's not really a question of my body, my choice. It's the collective health of the population versus you. It's kind of like, is one person more important than the whole population? And the answer is there's no way that's the case. So
Right.
for people to be doing stupid things and it's very frustrating because I'm not really a social media. I'm too old to really like it, but it's just not something I get into. My kids are very good at it, but my youngest kids, they just turned 17, the two knuckleheads, And they have this policy about the internet, which is trust but verify. And on a daily basis, they come in to me and say, Dad, this seems like garbage. And it looks very official. It looks like it's some organization with some health-based name, and it's pure garbage, you know? So I'm glad that at least some of these kids, and I wish some of the older people would not just take it all and believe everything. But I think the message I heard earlier was that this should be a collaboration. It shouldn't be politics. It shouldn't be, you know, like you've got a naturopath on here, and we work very closely with naturopaths, with nurse practitioners, with chiropractors, with health coaches, anybody that we can get to that touches a patient. And you really have to be agnostic because everybody can contribute.
Yeah.
And some of the best advice has come from my naturopathic colleagues who are, you know, focusing on making sure that people are healthy. Like, you know, for instance, we know that the comorbidities of diabetes and obesity and that sort of thing really contribute to this. And there's a physiologic reason for it. We know that if you have a metabolic syndrome, you're overweight or you're diabetic, the lining of your arteries has a coating. Sorry, somebody's got their phone on.
Okay.
Getting an
Okay.
echo.
Yeah, there's an echo. Okay. I'm
Anyway,
sorry.
it's called the glycocalyx. And if anybody's a fisherman, when you hold a fish, you can feel the sliminess. That's like the coating on your arteries. Well, those people, the obese, the metabolic syndrome, and the diabetics, their layer of protection over the endothelium, the lining of your arteries, is about a third what it should be. So they're more susceptible to the virus. They're more susceptible to injury. And so we know that's the case. And the other thing is that the virus itself requires an ACE2 receptor, which is found predominantly on the arteries and to a lesser extent, the smooth muscle. It's in every organ, but the arteries are the most exposed. That's why it's an endotheliopathy. It's an inflammation of the arteries. That's why the lungs, the heart, the brain, the kidneys, the liver are most affected by it. But there's something unique about this virus that we didn't really fully understand. Remember the original SARS-CoV, I think it was 2004, 2005. That virus used the same receptor, the ACE2 receptor, but it required a coenzyme that's only found in the lining of the lungs. So it didn't spread to other parts of the body. Now the SARS-CoV-2 mutated, and it uses a protein called furin, which is found in every cell in the body, which is why the virus goes everywhere. You know, it just doesn't get confined to the lungs, and that's why it's so bad. So we're learning these things. It's allowing us to make better decisions. I'll give you another example. You know, everybody talked about the cytokine storm, but there is a second phenomenon called a bradykinin storm, which makes your lungs super leaky. And there's an old drug for it's something called hereditary angioedema. And that drug actually helps with the bradykinin storm. So, you know, all of this stuff needs to get disseminated out there. And I don't want to take up too much time, but we have learned a tremendous amount. And the problem is it's not getting disseminated in a collaborative way. It hasn't really allowed us to form a partnership, although I'm seeing frontline doctors get together and really share things. I'm not just in where I am in California, but other places, and they're sharing data. And interestingly, they're using social media to share the data with each other, using things like doximity and other things like that. So I'm hopeful. But at any rate, I talk too much. You know me.
Oh, thank you. Thank you very much. We are having technical difficulties like you would not believe. I think it's all because of the doggone COVID.
I'm going to
Let's
blame
go
it on COVID. Yep.
Let's go to Dr. Harris. Dr. Harris, I'm scared. And Dr. Zarif, I'm sorry, we're going to come right back to you, but I'm scared to ask.
I'll be to hear that. That's it. Dang.
What'd you say?
Nothing. I just said, oh, dang, like a little boy.
Oh. No, I want you to piggyback on what Dr. Harrington is saying. But one thing I want to get from Dr. Harris, all of you are frontline doctors. And I believe Dr. Harris sees this day in and day out. All of you see it day in and day out. And Dr. Harris is hands-on just like the rest of you. Dr. Harris, tell us what's going on in Houston before we get to Dr. Zarif, and we've got to get to Dr. Zarif. So can you tell us what's going on in Houston? Because it's crazy everywhere.
Yeah, it is. And, you know, I've been doing inpatient work for COVID. I've been treating patients outpatient. I've been doing my podcast, talking about holistic medicine and lifestyle medicine. So I've been working this from all angles that you can possibly work this from. And here in Houston, it's nuts. We had one of our largest hospital systems shut down 3 ERs in the city to funnel workers to the main hospitals because they just didn't have the bodies. They didn't have the capacity to keep those ERs open. They had nowhere to put the people coming through them. And we had a case where a pediatric patient had to be life flighted hours outside of the city because there were no pediatric ICU beds. And I think it's funny because people are so domain dependent. You know, we are so, we see only what's right in front of us. All you see is what there is, right? Daniel Kahneman says this. So if you're working in the hospitals, all you see is death, decay, sick people everywhere. So people in the hospital are shouting, everyone needs to get a vaccine. You're a horrible person if you don't get a vaccine. What are you doing? You're killing people by not getting vaccinated, because that's all they see. Well, that approach isn't going to work on some guy who's on the, you know, in his house, who's maybe going to hang out with friends, maybe going to work, you know, who doesn't see this, who hasn't seen anybody get severely ill from COVID. And they're going to say, well, this is not that bad, because that's what they see. And so we need to have do a better job as healthcare providers at showing people what we're seeing, but doing it in a sense of compassion and with understanding, and not angry and yelling at people and calling people a bad person for not getting vaccinated. Because if you said that to me, then my first response is, well, I'm not going to get vaccinated. I'm going to be a bad person, right? Because you just came to me at a 10 when I'm at a 2. You got to come at me at a 2 so I can respond at a 2. And that's what we're seeing here in the city. I love what Dr. Harrington talked about. The fluvoxamine is something that I've been using. I've also been yelling from the rooftops to anybody that will listen. What we're seeing is a metabolic phenomenon. This is a cardiometabolic phenomenon. There was a report last year that said 63.5% of the hospitalizations could have been prevented. And though most of those were attributable to diabetes, obesity, hypertension, and chronic kidney disease being a small portion of it. And so I'm a root cause guy. Whenever I think about something, I'm not a slap a Band-Aid on a guy. I'm a root cause guy. So if this is a immune system issue, my root cause is strengthen your immune system. How do you do that? Get sunlight, have a stress mitigation practice, you know, meditation, prayer, mindfulness, your nutrition, avoid the processed foods, eat plenty of fruits, eat plenty of vegetables, get some exercise, get adequate sleep, right? Still have a sense of purpose. That's very important for humans to have a sense of purpose and a sense of drive and a sense of well-being. Stay connected. Maybe that's not in person. If you have risk factors, maybe that's through a Facebook group. You know, we trash social media, but there's a lot of good that social media can be used for. It's a tool, and everything about a tool depends on how you use it. I can use a kitchen knife to cut my steak or to kill somebody. It just depends on how I decide to use that tool. And so these are the things that I've been doing, the things that I've been seeing. What really, I'm pro-vaccination, I'm pro-choice, right? I believe you should have a choice in getting the vaccine or not. But I believe that if you don't get the vaccine, then you should be doing everything you possibly can to keep your immune system in the best shape as possible. We know we went in the opposite direction. People gained 1.5 pounds a month, which is what they usually gain in a year. Pediatric data, and I don't typically read a lot of pediatric data, said there was an 8.3% increase in the kids who are overweight and obese. Up to 40, I think it was 43 or 44% of kids in this survey were overweight and obese. And Dr. Harrington did an excellent job of describing these risk factors are real. They cause changes in your immune system, changes in your vascularity, changes in your hormones. And all of this makes it an uphill battle. Now, would you rather walk uphill wearing your clothes or walk uphill carrying a 50-pound dumbbell? I'd rather walk uphill just in my clothes. And that's what happened when I got COVID, because I was healthy, because I had these practices. because I knew what to do. I had a very minor case, and I actually got it working in the hospital in the ICU. So I got exposed to a massive viral load of COVID. I got it despite all the gear. I knew that because I was on a travel assignment. I wasn't doing anything except working in the hospital and going back to the hotel. And that's, like I said, walking uphill with just your clothes on, because I have these behaviors. I knew what to do. I had my vitamin regimen. I kept my health behaviors. And I think we could have been in a widely different position if this is a message that everyone had been screaming from the rooftops when this began, because a lot of what we did unintentionally made things worse.
Yeah, it did. I think we all can agree on that. What we did, it did make things worse. And I don't think that people are looking at it in the way that any of you have described. I think that people are thinking, one, it's not that bad. I got a call, a very disturbing call today about someone in Altadena who was taken away in a paramedic van because he'd been at home by himself for 8 days and then called the neighbors to say, can you take me to ER? And the neighbors all said no, because the neighbors knew that he probably had COVID. And sure enough, when the sheriff got involved and they called the paramedics, he's got COVID. So right now, as we speak, he's probably on a ventilator at Huntington Hospital. But he decided not to wear a mask. He didn't want to wear a mask, and he did not want to get vaccinated. So he's down at Huntington Hospital on a ventilator. And it could have been avoided. It could have been avoided. And that's where you come in, Dr. Zarif. How can this be avoided? As I said in the beginning, we're dealing with people who are not getting the proper information and who still are not healthy. McDonald's, Burger King, Wendy's, Taco Bell, they should all be closed down right now. They should all be closed down because people will not do what they think if it is not in front of them. And when you leave them to their devices, they're going to prove you wrong every time. Every time.
Well, you find that the main component of control, the main component of authority, the main component of population control is agnotology. Agnotology is the study of ignorance. All of this confusion that we have, even when we're talking about the Delta, it doesn't make any difference right now. If you get your shot, you're still chasing the disease, because Delta doesn't have anything else to do with the original COVID-19. That has changed into a whole different thing. Delta is a whole new variant. And when you get a new variant, you have to start from zero all the way over, in other words, and then that is for that particular variant. But you can't think just because you're going to get a shot for COVID-19 or anything other than that is specificity. That's the important thing. That particular thing is made for that particular shot, and that's it. Most of the shot now, if you look at the latest reports on COVID, most of that is mutated. It's like almost nil now. The shots that we're getting now will attract more damage to the body and more threat to the body than it would if you wouldn't get the shot. Now, I know a lot of people are arguing about it and, no, I'm not going to get it because of this or that. But with the people that I deal with, mostly they're afraid to get the shot because they just don't know any better. And you have the group of the PhDs, the nurses, the essential workers over here, they're saying, I'm not going to take the shot because I don't there's not enough research done or whatever their reasons. Then you have other people that have less than a high school degree, and they have enough sense to know that they don't know. So they depend on the government. They depend on doctors. They depend on people that appear to have the knowledge. Here are some of the reasons that we find a lot of convolution. Here are some narratives. The political narrative today is opposing the government is sabotage. So people really feel that if they do things that will oppose the government, that they're in the wrong. They're doing the wrong thing. Religion's narrative is don't question God. The law's narrative is respect the men and women in uniform. In medicine, respect the men and women with the lab coat and stethoscope. And then you have the food industry that has a lot of label deception. So there's a whole lot of deception there, and a lot of debating, and a lot of and not too many things that are different there. They're all in the same, because they're making people feel bad if they go against the authority. Now, you might remember, I think it was 1994 when they had the Waxman trials. I don't know if anybody remember that, but they had a representative of all of the major cigarette companies. And each one of them, one by one, lied in the camera in front of millions of people that they believe and they stand by their statements that tobacco is not harmful to the human body. They all agreed to it. It wasn't any skepticism, any hesitation. They all agreed with it. Then you can think about other things like the Tuskegee experiment. Now, this went on forever. They was doing this from 1940 all the way up to 1970. And the same thing, they were lied, or we were lied, like especially Black people in the Black community. We've been the brunt of those lies, because we've been like a very important part of it. A lot of these Black men, they were tested for syphilis. They were given syphilis, and then they just watched them die. Then you have, I forgot her name, that had the DNA when they did the secret experimentations with that. And it goes on and on. You know, they had a big suit with, I think, the photography chemicals. A lot of photographers start dying from cancer, and they had throat diseases and so forth. All of this came from, again, something that they said was safe. So before we as professionals can start to make the corrections with what COVID is and what it isn't, we have to set a foundation in which they can trust, where the people can actually trust. You can't build a house on a wooden foundation. You got to have a strong foundation. So children, along with teachers, along with other professionals, we continue to propagate those same lies. And then here we are. Western medicine is excellent, it's beautiful, it's incredible. We could not live without it. It's definitely incredible, except for one component. It is reactionary. It's after the fact. Many doctors, not you good doctors, many doctors do throw medications after illness, but they don't tell you the causes of the illness. They don't tell you how to avoid the illness. And that's where we are today. We're in that same thing, waiting until after the fact. This whole thing with this, we've been through this before, and many people have died before. But again, America does the same thing. Just like they say that war is good money, the same thing with these types of travesties. This is good money, but I don't think that it's all about money. You have to follow the money, but really and truly take your time and listen to the politics of it.
Thank you. Go ahead, Dr. Carlisle.
I have to disagree with a few things that were said. I think we do need to look at the evidence. We do need to look at people's motivations. Pfizer did take money to participate in Project Warp Speed. And yes, Pfizer does make money when they sell drugs. Pfizer has no reason to want to cause us harm. That's not in their interest. Number two, the folks who want to argue about Pfizer and the COVID vaccine, the same people are willing to take Viagra that Pfizer makes. That was released after testing with 1,000 people. And they have all this lather up about the Pfizer COVID vaccination, which was tested with 30,000 people. So I really don't understand the inconsistency. I realize that Pfizer wants to make money. It's in their interest to have effective treatments that work. that they can bill people for the treatment. So I expect Pfizer to have performed due diligence in order to create an effective vaccine that people will use. The data shows that while the current vaccines that have been approved are not 100% effective, and we are in this chase against the virus evolving versus our ability to treat the virus, and and effective herd immunity and effective vaccinations help us get there, that we still have to realize that if we want to reduce the odds of dying of COVID, and COVID is a lethal disease, people need to get immunized. If we want to ensure that there is capacity to treat other conditions, because I feel sorry for the cancer patients who can't get their chemotherapy because we have beds filled with COVID patients because they don't get a second chance to get their cancer treated. I feel sorry for the patients at Huntington Memorial Hospital, a wealthy hospital in Southern California, where patients were stacked in the gift shop because they ran out of beds. I sort of suspect that a hospital bed in a hospital room is better than a hospital bed in the gift shop, but I'll let you all discuss that. So I think we need to have an understanding about the level of the catastrophe we're facing as far as number of deaths, the impact on life expectancy in this country, the fact that we are finding things as quickly as possible, but that it is not in, and yes, there have been many failures in the past where the Tuskegee experiment, those humans were deprived of recognized effective treatment. And that's a separate conversation. But right now, many people are trying to get effective treatment to people as quickly as possible. And that we do have to navigate how much uncertainty we're willing to tolerate while the disease is rapidly killing people.
Well, you know, these things are connected. The reason that we don't trust, you know, that was a question. The reason that we don't trust, and you did a comparison with an opioid or euphoria. You can get a euphoria from, you know, like maybe Viagra, whereas, you know, if you're talking about being vaccinated, that isn't the same thing. We're all addicted to euphoria at some level. So we have people that will, of course, like to get something to make them feel good versus something that will make them feel healthy. It's really important to know that the things of the past has to really amount to the things, how we see things today, because that's the only way that we can predict the future. And the current daytime is that we have to look at what has happened in the past. And it's just not that those doctors did not give those patients the right treatment. And this is during mass incarceration. That it's not only that, but CDC, the same company that we hear the most about, the Center for Disease Control, are the same ones that actually conducted that experiment. So people find out about these things and they're like, wait a minute. Weren't you a part of something bad that affected my people? Why am I going to why am I going to believe you? There's no reason. So you see a lot of people are actually fighting, not just to be nasty and just say, I don't want to do this. It's because that our past, definitely, we have a stinky history.
And go ahead, Marcus. Go ahead, man.
Thank you. And this is to kind of bridge this conversation with respect to what's being presented, which is fear. And coming from the clinical perspective, the spiritual perspective, how, as I presented it in my book, Dig Deep, when you boil this all down to, we're afraid of losing something, right? When it comes down to these premises. So if we were going to engage in this conversation and understanding that this is conflicting ideas, everyone here, when it comes down to COVID, is afraid of losing something. What do we believe this is when it comes down to the vaccination, when it comes down to our identity, when it comes down to going into these clinics Dr. Dr. Richard, he left, but he was in Houston. He's serving, right, our population there, but he got COVID himself, right? It's very real. You can't get past this reality, right? Dr. Zarif, this historical factor, it's very real, right? Dr. Carlisle, if I'm saying your name correctly, right?
Yes.
These instances, right? I'm going on 41 years old, right? My testosterone, it bumped down a bit. I found some natural ways to get it up, but I was thinking about Viagra for a minute, right? Holistically, I
Can you
was
share that
able
with the rest of us?
My wife is tuned in. I'm not going to share our secrets, right?
Right.
Our bedroom is our bedroom.
Right.
But the
that
point
has nothing to do with COVID.
oh, nothing at all, right? But the point that I'm making is, right, we're all very much a part of this human condition. The reality here is fear is really at this foundation of this conversation, right? And the premise of fear is loss, right? What is at loss is grief, right? And if we're talking about Dr. Zarif's historical context, if we are in the past, then there are some ungrieving pieces of this conversation. So I just wanted to present this as a portion of this conversation, right? Because I do believe that there was a component here that was being missed.
Okay, thank you very much, Reverend. Thank you. Let's go over to Dr. Orkay. Dr. Orkay?
I think it's just really interesting, and I absolutely enjoyed Dr. Carlisle addressed the comments and also the wrap up with my brother, the Reverend Marcus. Yes, it is clear that the currency we don't have right now is trust. And we have no doubt about that. It's in low supply right now. It's in high demand, but it's in low supply. We don't have it. Yes, why should they trust us? That is, it's very legitimate to ask, why should they trust us? But as Marcus said, fear is not part of the treatment protocol. Fear of losing something, is it your autonomy? Is it like your white coat being in charge of things? No. The big pharma are actually invested in our being alive right now. We've given the list of down the historical lane about, the Tuskegee and every other thing that's happened. But remember, we also have the thalidomide. And all my colleagues will know how safe thalidomide was referred to as, for pain and everything. The advert also include how safe it was for children, for pregnant women.
Right.
And it took a while before they saw the kids being born with the varying, short limbs, no limbs, and so on and so forth, before, the whole drama went in. But that is not, it's not the same as what we have now. I know we are in the crossroad where we have politics with healthcare, but we also have about the social factors too. We cannot use fear. We should build trust, and we should not, it's gloom and doom, but we must still have a spin to it, and the spin has to be positive. There is a way out of it. I called a friend on Sunday, just last Sunday. I've not heard from her for a long time. I've tried to call her 3 times, but she finally sent me a text message. Just before the pandemic, at the first quarter of last year, she called for an appointment for a mammogram. And they told her there was a lag period of almost 6 months. I know life happened, and she forgot. Right just about the 6-month time or 7 months time, she felt her breast. She felt a lump.
She wasn't thinking about it. She felt it again. Then she looked and she noticed there was a poker to it, For the doctor said, that is never a good sign. She finally called and said, "Oh, yes, you missed your mammogram." She said, because of the pandemic, she wants to be at home. She wants to be safe. Now, what has she done since the third quarter of last year? Now she has done radio. She has done chemo. She has had a mastectomy. She's now on the immunotherapy. So life continues. With or without COVID, people will still be unwell. People will still be sick. And the delay, the classical three delays, top on elite now, without decision and access is there. It may be inconvenient to put a mask on your face, but I sure bet everyone knows that being intubated is worse.
Mm-hmm.
But now the same people talking about vaccine and no vaccine are the same people pushing ivermectin, the warmest speller that we use for animals. So my question now will be to Dr. Zarif. How do we address this? Why all of a sudden a novel item like ivermectin, which we know is not what we should be using, it's not first line, second line, third line. Why should we be trusting people touting ivermectin after we've already pushed isochloroquine away?
Mm.
And it's healthcare professionals, of course, in Facebook and YouTube. Oh, because it's the conspiracy theory. This is what is causing the problem now.
Yeah, actually, I agree with you. I mean, there's a lot of people that talk about, they don't know what's in the vaccination. And it's like, they don't know what's in that batch. And it's like, but like you said, they don't know what's in ibuprofen. They don't know what's in, you can't tell me what's in Tylenol, Right. I mean, it's just very simple things. So you're absolutely, I don't challenge that. What I challenge is that we as professionals, there are some other ways to approach a community that hasn't used community acuity well. We haven't learned from the things in the past. Every time we talk about this, like we've been here on an hour, but we need to dispel or to demystify some of those things that would keep our children and our leaders strong. I think that it is just as much or more confusion and convolution as to what to do right now as it was in the beginning. We have very smart doctors, and I definitely will attest to that, because doctors are just, they're lifesavers. However, I think that it is also our responsibility to not only teach, but to empower these individuals that feel powerless about what they can do for the human body. Immune system is kind of, what does the immune metabolism? What's the metabolism? We haven't done our jobs when it comes to that. And I think that we can do better jobs in helping to strengthen the educational to enlighten these individuals more, because after all, we know it, we can pass it on, not just they're used to here's a script, here, take this and take it for this long and so forth. But if we say other things, like, I know, for instance, like a mask, if it's a virus, really a mask is going to stop a virus? As I understand the definition of virus, there's no virus that's going to be stopped by a mask, but it may help you with aerosol, bacteria, so forth. But people need to know that, not just for them to say whatever they want to say on these, like from politicians to other leaders.
Well, there was conversation about what the mask provided. Early on, there was a great deal of conversation when the masks first hit the scene. Mm-hmm. There was a great deal of conversation about what the mask would do for the individuals that always wore masks. So even right now, I wear 2 masks and a face shield. I don't leave home without it. I have been wearing a mask on a flight for at least 10 years, maybe 12. I never flew without a mask. Never, ever, never, never, never. All 4 corners. I never flew without a mask. So
Mhm.
wearing a mask for me, it's a no big thing. And I don't want to wear a mask all the time. I do not want to wear a mask all the time. I want to be safe. I do not want to be reckless. I want to be as cautious as I possibly can. So we know that a mask is not going to be 1000%. But we also know that for those people who don't wear masks, you're adding to it. Those people are adding to it, no doubt. And there's so many people who don't want to wear a mask and then they wind up in the hospital. They wind up in the hospital and they take a bed from somebody that really needs it. They really need it. We know that. But a mask can offer some sense of protection. We know that it's not going to be the greatest thing ever, but it lessens the risk.
Definitely. And but one of the things too is that, we are a society that is more excited about getting back in the bars. All these people dying, all these people, hundreds. There's like what it was 200 million people that was exposed in the United States that was exposed to the virus. 200 million. The biggest cry from all of these 200 million people, open the bars back.
Open the bars.
Euphoria is something that we can't escape. All of us. I don't care if you get 40 degrees. It's all of us. Euphoria is that great feeling. That's why people love the dopamine and serotonin and so forth. That's really important. So when you do that and you compare that with putting on a mask, or you have to go to bed early, there's a curfew out 6 feet behind each other and all of that, it becomes more about entertainment than it's important about your personal health, unfortunately.
Well, there are diagrams, and I'm sure all of the doctors can attest to this. And remember what I told you all last time. I got my MD from WGU. There are diagrams that describe how this travels. And to me, and again, I got my medical license from WGU, and you may be wondering what WGU is. I'll tell you at the end. Anyway, it's a little common sense. We tell kids in elementary school, cover every cough and sneeze so you won't spread disease. We tell kids, if you're going to cough, if you're going to sneeze, do it right here in your arm. Do it right here. Then go wash your hands. Well, what is it with folks that walk around coughing and sneezing and they think they don't have to cover anything up? We tell elementary kids, first grade, second grade, third grade, cover every cough and sneeze so you won't spread disease. Does that have a meaning to you as an adult? So if we're in the age of COVID and it doesn't look like it's going anywhere, what are we going to do? The masks provide a level of, I don't know, they provide a level of safety that we all must have. So a mask cannot be that inconvenient. To me, that's just me.
Yeah, you have to have like one of the stars, the celebrities. You got to have their leaders tell them that they have to see their leaders doing the things that you want them to do. Other than that, you're just an old lady talking, or I'm an old man talking. See, there you go. Take it easy.
I'm not an old lady. Come on, everybody, let's stop it right now. Let's stop right now. I am not an old lady. I have to correct my daughter.
I deserve that.
Not old.
Well, there
I'm
comes a social psychology of this, right? There's an who looks at the leadership, number one, and then there's this piece where if we are looking at the Western ideology of things, everyone is an individual, right? The collective unity of this is coming out of the now progressive idea of I want to put it in a sense of Western enculturation, right? And that's never been based upon the communal sense of things. Okay. And in that idea, no one has accepted that as a community, we're able to flourish, each one reach one, teach one, right? And in that anthropology, right, and cultural anthropology, the more Eastern way of looking at things, the acceptance of unity or unifying and being of a more holistic maternal element, right? Over here, the patriarchy is what defines us, right? So everyone wants to rule. And if we're going to rule according to the patriarchy rule or the patriarchy identity, then someone has to be up front. And if someone is going to be up front, then that person leading is that A-type personality, and that A-type personality is the egoism, and that egoism, that I-ness and that minus, is going to present itself, and that's why the media is so strong. And to summarize all of this, this Western presentation, especially under the previous political climate, and I don't like to talk politics, that's why it ruled so much and why it had to be dismantled in the way that it appeared to be across the stage. And I use those terms very specifically. It had to be dismantled on the stage.
Okay.
I have a
Doctor-
question. It's just, and I can, like, Jan, you can always get with Dr. If what we're seeing with mistrust, really breaking up.
Mistrust. Yeah, you're really breaking up.
Okay, how are we looking for, are we ever going to get to herd immunity?
Are we ever going to get to herd immunity? That's what I was going to present to Dr. Harrington along with another question. Dr. Harrington, can you answer that?
Yeah, do you mind if I make a comment on some data?
Please. Yes, please.
Before we get to that. So I want to make a call out because this relates to using personal protective measures like masks and hand washing. And then, we were in Crenshaw, Baldwin Hills, and the national African-American infection rate was very high. It was above 17%. But there was a community organizer there who I want to call out. Her name is Gina, and I can't remember her last name. But she was amazing. She single-handedly went out and educated the public. She put a booth up where we were doing the blood draws, and she was giving free hand sanitizer and masks to everybody. We donated a bunch of them. The infection rate in that group, in that population, was around 3%. And if you contrast that with the national average for African Americans, it's staggeringly impressive. And what that shows is that public health initiatives where you go directly to people and you educate them on these things, getting back to the basics of covering your mouth when you sneeze. I saw this cartoon where somebody was in Texas and they sneezed and there were 6 people pointing guns at him immediately. It's almost like you got to do something like that. But getting back to herd immunity, most of the people that are having what we call breakthrough infections right now have variants, and we're up to iota. We're, whoever said we're beyond Delta, but the thing is, they don't persist very well. They're not very robust, which is good news. Mm-hmm. Remember the original criteria for the vaccine was it had to be 60% effective. Okay, and the flu vaccine is typically 40 to 50% effective, but it still helps. So even with the Delta variant, the vaccines, and they're now down to around 66% effective. That is still going to help us tip towards herd immunity. Okay, and the part that people keep forgetting about is we've now had, I believe it's around a third of the population infected in some form, not hospitalized. It's a fairly high number. You add that to the people that have been vaccinated, and we should be getting close to that. So the real kicker here are the variants. So like, I give you an example. I'm in Orange County. I live in San Clemente, and we didn't have any Delta variant here for a while, but a gentleman came from India with his entourage to give a talk here. And he didn't have it, but one of his entourage did. And suddenly, now all we're seeing, 60 to 70% of the infections are Delta 5, which brings home the fact that while this virus doesn't appear to be more virulent, meaning that it has about the same level of getting people sick, it's significantly more infectious. So that has two things that are going to happen. One is more people are going to get infected. It's going to mean the number of people that have kind of got some form of immunity is going to go up. And so I think the unknown part is, are any of these other variants going to take over and make the vaccines that are currently out there useless? Now they're modifying some of the vaccines, and I think that it's pretty easy to do that. We use a special test to determine whether your body actually made the right kind of antibodies for the virus. And we're pretty impressed that, given that you don't have diabetes or metabolic syndrome or an immune deficiency, people are doing pretty good with the vaccines in terms of the antibodies that they're producing. And the ones that do get vaccines, if they do get reinfection, which by the way appears to be a small number of people, and most of those are again variants, they don't get as sick as people who have not been vaccinated. So you could make the argument that, number one, there's absolutely nothing wrong with protective procedures, just doing what's courteous. I mean, you talked about you've been wearing a mask for 10 years. In Asia, they've been doing it for 30 years. They don't go anywhere. They think it protects them from pollution. Well, it doesn't really protect them from pollution because the particulate matter gets in there, but it keeps them from infecting other people, and they're used to that. And now they've made it a style thing. So you've got, Louis Vuitton masks and God knows what else. And, but at the end of the day, I think, what we have to do as members of the human race is do what's right for everybody, which is take your precautions. If you are so amenable to it, you should get the vaccine. And if, the only part that I'm a little bit hesitant to endorse is the need for a booster in healthy people, because
that was
the
my
immunity,
next question to you. Yes.
Yeah, the immunity seems to be very durable. All the studies that keep following patients. This is just, and I'm sorry I'm talking so much, but I just
No, please.
Your body, the human body, is actually incredible. And I think it was Dr. Zarif talked about the fact that it's better to prevent disease than it is to treat it after you get it.
Yes.
I'm actually what's called an oxymoron in medicine. I'm a preventive cardiologist, which means, we don't get paid the big bucks because we're not doing the interventions, but we have immense satisfaction in keeping people out of the hospital and from having heart attacks. Yes. And to me, that's far more rewarding. And so, since most of these people have some form of metabolic abnormality that they have done to themselves, because they go, like fast food places, they'll use the cheapest oil on the planet. And the problem with that is that those oils have lots of omega-6 in them, and they damage your immune system. They make you less, and then the other thing is that people deplete their glutathione levels in their body. That's the major antioxidant in your body that protects you from these. But what they forget is that glutathione is required to recycle vitamin C, vitamin D, vitamin E. If you don't have enough of it, then your immune system is going to plummet. So we can't just be giving people drugs and vaccines if they're not going to do something to take care of themselves and get away from that. So at the end of the day, as a preventive cardiologist, I abhor the fast food joints. What they put out there and what people get is horrible. And the worst one is Starbucks. I have kids going there and getting a venti caramel macchiato with 80 grams of sugar. That's 20 teaspoons of sugar they're sucking down in one drink. Of course their immune system is screwed up, Anyway, I'm sorry.
And
you got me ranting.
And not to mention the endothelium, Doc.
It damages the endothelium significantly.
Yeah. And people think, I hear a lot of people talking about, well, so-and-so and so-and-so, and they just don't get what's really in front of them. You see this in front of them. And just like Dr. Carlisle said, you people are taking all of these other things, but you don't want to take this. You don't want to take this vaccine, but you don't know what's in Tylenol. You really don't know what's in your food, but I see you sucking that down.
Yeah.
Okay.
Yeah.
You don't know what's in your burgers at McDonald's, but I see you in line right now. Okay.
Yeah.
Okay.
And if you drop
But
that
you
burger, it'll still be the same in 20 years.
Exactly. Don't forget the man that had that burger in his pocket for 15 years and it came out the same way 15 years later. Wake up, people.
I had one of my patients yesterday giving some kind of human relief. I was asking them to get in shape. I said, man, you got to get in shape, man. This is the 4th month. Look, you got to get in shape. He said, I'm round. That's a shape, ain't it?
Right. Well,
that's the shape he's in. Round. Okay. Okay. Well, let me ask Dr. Carlisle another question. Dr. Carlisle, what is your greatest fear regarding COVID? What is your greatest fear regarding COVID? Is there anything that we don't already know? Is there something else that we need to know? What do you say?
Well, I think my real concern is severalfold. Number one is if we don't get ahead of variants, there could always be the worst case scenario.
That's
where
right.
we have something that is more easily transmissible and more lethal. We've already had the luck of the draw, but I don't expect, the managed care fairy to protect us all the time. So we need to be making plans in case, worst case scenario of a more lethal, more transmissible variant. And to me, that's one of the reasons to try to control COVID with immunizations early. I think if we end up having a situation where it's like the flu, it evolves a little bit, we get a new vaccination, that is acceptable compared to the outcome of significant mortality. Let's not also forget significant morbidity for those individuals who are COVID long timers. And I actually have a cousin who was in 2-row infirmary for the month of March 2020. She just got off constant oxygen last month. She's on intermittent oxygen. And this is a person who only had high blood pressure, no other risk factors when this all started, no obesity, no diabetes, just a little bit of hypertension, like all self-respecting Black middle-aged people. And so I think, we don't know the impact of long-timer syndrome and how that's going to affect people's quality of life and additional complications. I have concerns about that because to be that sick a long time, doesn't sound like a
long
good
time. Yeah.
Yes, from, my own cousins hasn't been able to go back to work in a year. Well. So I think
That's a long time. Yeah.
These long timers may have additional complications we're unaware of and we don't have line of sight into. I'm also worried about the kids because we're not able to vaccinate the micro people. Yeah, we can, vaccinate, people who are 12 or about my size. But what's going to be the long-term impact to 6-year-olds?
Yeah, absolutely. Yeah.
And they're starting to fill up the hospitals.
Yes,
and
they
so
are.
I think, not only will we have the acute illness, but what's going to be the ongoing impact of COVID long time to an 8-year-old who couldn't get immunized? And so I think there's a lot of things that are unknown that are concerning, which is why I think for those of us who are capable of being immunized, let's get vaccinated. I think for those, we need to understand that the virus may evolve and our knowledge may be evolving. So we need to be aware that what appears to be the truth today may not be the accurate facts, a year from now.
Right.
Yes, I think that is really true because as we think about the long haulers, remember it used to be a respiratory virus. Now it's a multi-system, a multi-organ disease. But there's one thing I've been talking about for the past 1 year, which is for the clinicians said they know COVID will soon be regarded as a pre-existing condition. And having had COVID, imagine what your premiums will be if and when there's a change of government.
Yeah.
People
Yeah,
are
that's
not looking at it from the economic part of it. We've talked about the social part. We're talking about the medical part. For example, it was Delta Airline that says, if you are not vaccinated, you'll be given a surcharge of $200 as a staff
A month. That's right.
a month. Okay,
Yes.
now let's hold that. Now let's flip it. The insurance company will tell us, if you've had COVID, you see,
Yeah.
then knowing that it's a multi-system, multi-organ disease, not just respiratory virus, that $200 we're passing to staff will be passed to us.
Right.
So 200 times the millions that have had COVID and have survived, and going down the line, because we want to take the risk. I also have a colleague that had just the cold. She never came back to work. Just COVID. Multiple organ failure, now on intermittent oxygen from last year. Had dialysis, and all she really had was high blood pressure, a bit of borderline cholesterol. I remember speaking to her on the phone and forcing her to get out of the clinic. And she said she was the only attending the present. If she leaves, the clinic will close. Guess what? She's at home now. The clinic is still working.
Yeah.
When she was on sick leave, she was already replaced.
Right. Of course.
And,
of course.
and then fired.
Right. Of course.
You speak so much truth.
Yeah. And the other is people just, again, my question is, what is the thinking? What is the thinking? What are people not thinking? Because certainly they are not thinking.
Fear-based.
And I'm not, say that again.
Fear-based. It's getting beyond
it is fear.
the fear.
Yeah.
Perception versus reality.
Yeah. And we
what
don't.
about the fact that we stop being kind to each other?
Stop being kind?
I think we have stopped being
we are no longer kind.
Oh,
Yes.
We are thinking about ourselves only, not the collective. We cannot agree on the common good. So it is me, me, me. This is a real me movement.
Yes.
Well, I think that's one of the things that we talked about the other day was, it's this identification crisis. That's what really, the worst disease on the planet is low self-esteem, as far as I'm concerned. It's like if you get a person that doesn't believe in themselves, if you get a person that don't love themselves and love the people around them, they're not concerned enough about themselves to take care of themselves. I don't care what kind of medicine you approach.
Yeah, that's true. That's very true. Very true. And we should be looking at people saying, whoa, we're over that. Oh, thank God it's gone. Yeah, we can get back. But whatever made people think that they could just throw away everything that we went through for 12, 18 months, and we're just all of a sudden going to go back to the way things were in 2018. We will not get back there. That's truth. We will not get back there. This is a brand new day. This is a brand new day. And
but you have to be careful with that. Remember, we 400 years ago, there's a lot of things that happened under time and all of that. So it's like we have to be careful because we get complacent very easily, and Black people have a very short memory at times, to forget the things that we have gone through. So when we come together and we start doing things, we have many distractions. And some of those distractions, like for instance, is still teachers are paid much less than a basketball player. We still got people that are very, very important to our entire community, but they don't really highlight these people. It's just that they're just, it's kind of like mom and dad, let me walk to the front door by myself. I don't want anybody to see that I'm with you. But when it comes down to it, we have to change these priorities that we have. Because like I think somebody mentioned it earlier, but we need to respect the elders. We need to respect the children. Right now, the children are pawns, going in there and see what's going to happen to you. I hope it don't happen to you.
So we have to come back into this space where not only our voices become more impactful, but the space for our voices become more of a space for facilitating that change. We believe that, or let's put it this way, the certain minds of us believe that Instagram is where the biggest change is going to happen.
Yes.
And that is not true. That is a construct of thought, which is why they call it an influencer, right? Where
Yes.
what is really happening behind the scenes of policy and legislation is where the real change is happening. So we have to get the individuals who are really thinking and really want change to get into those spaces, which means that we have to understand that the importance of systems of change is to get those real influencers in those locations, right? And the scrolling and laying in your bed and being comfortable, we have to get some people uncomfortable, right?
Yeah.
And
Don't forget those who are comfortable being uncomfortable. They are not moved. Don't forget.
Right. So people in this space have become very comfortable in their comfort. And that was another aspect. In the US, we get to be comfortable, and that's the problem. Everybody else outside of these lanes of comfort have been tired of being uncomfortable. And so those who want change are tired of sleeping on the street, are tired of being sick, right? Are tired of being affected. And so now when you're having these catastrophic conditions as a result of the sun actually influencing the earth, right? Now people are starting to question what's really happening in the world around us. And then when there's actually a sun to geospatial to behavior linkage, then you're like, oh, you know what? Maybe I'm not thinking this way just simply because I'm having a bad day, but maybe everybody else is having a bad day too. And there is an intercorrelation and link between everyone else. And then that's a social construct. And then we have to influence, right, what people are actually seeing on the TV or certain social medias to make sure that everybody stays in line with certain scenarios.
Right.
And that's called programming.
Yeah.
And one of those things could be that comfort is the worst enemy of success. You know, comfort is the worst enemy of progress, of production. You know, getting comfortable is a bad place to be.
It is. It really is. Dr. Harrington and Dr. Orkay, do you think, and I know we all of us who have the WGU MDs, we saw this coming. And President Barack Obama told us 12, 13, 14, 15 years ago that the pandemic, he didn't say if, and he corrected himself. He started out by saying if. He says, no, not if, when. Are you ready? And I think some of you probably remember when he said it. I recently heard it. When the pandemic strikes, and he says it's going to be here, will you be ready? So we know that this one caught us completely by surprise, blindsided, completely. Will there be another pandemic? Will this be ongoing? We have a surge of unparalleled, willful ignorance. And someone, I think it was Dr. Zarif that just mentioned the study of ignorance. Yeah, we're in it. We are definitely in it. And we allow people on social media to influence us, like the girls that do makeup with 156 million people looking at her. And she's called an influencer because she puts on makeup. So does everybody. All girls do. But she's an influencer. So how is it we got blindsided? Yeah, I know we were lied to, but are our eyes open? Are we looking? Dr. Harrington and Dr. Zarif and Dr. Orkay, Dr. Harrington, can you go tell us, what do you think? Are we headed for another one? Will there be another one?
Well, this isn't the first one we've had. Remember, we've had the Spanish flu, the swine flu. We've had
To this degree?
No. Well, yeah, or the earliest ones were devastating. 24 million dead, that sort of thing. But I think it's inevitable with the way people travel today, the crowding that occurs in cities, the inevitable pollution of some of the lands, the way the environment has changed in the last 50 years, that this is like a practice run. This is not, this is one that, I think there are many things that could happen. I tell you a quick story. I used to work, one of my colleagues was doing something that I didn't know. And what it was is he was doing fusion virus projects for the DoD. And he fused a polio virus with a Coxsackie B3 virus, which damages the heart. And while doing his research, he dropped a flask in the lab, and within 4 hours, his heart was gone. He needed a transplant. And I guarantee you that someplace on the face of the earth, somewhere, people are doing things like that. And they may or may not have the right containment, but I think this was like a slap in the face saying you need to get your act together and have a national game plan, not a maybe this, maybe that sort of thing. We have to say to ourselves, this is a practice run. We're still in it, but we got to be prepared for the next one because it's coming. It has to. Now, I will tell you that I think the adoption of the mRNA vaccines is just one of the most earth-changing things in terms of vaccines, because those are originally designed for cancer and for HIV, and they were rapidly adapted to this. And the fact that we can sequence things now and identify them quickly gives me a lot of hope. But as you pointed out, and everybody else in here, if we don't take the public health approach, if we don't think about the population as a whole, and we'll let everybody do things willy-nilly, it's never going to work. We have to have some national backbone of guidance and response to these sorts of things. So.
Thank you. Dr. Orkay.
Yes, thank you very much. And Dr. Harrington just aptly placed it. The only thing I will add is that this is it's a perfect mix we are facing right now. It's a confluence of multiple pandemics. It has given us the fact that we've had the Spanish flu and all the others before now. But think of the pandemic we have now. We've already addressed it with that of the disinformation. Then think of the political COVID we have on top of the virus itself. But are we ready? Barack Obama in 2014, December 2nd, because I used that slide in my class, already mentioned this about the state of preparedness. And a few years later, prior to Barack Obama, President George Bush was actually at the forefront for pandemic and response and preparedness. He read the book and he said, hey, are we ready? And set the ball in motion. And Barack Obama said, yes, I've inherited all this and I have all of this. Maybe we should really move this up now to the level of the White House, almost to the cabinet level. But we also know what happened after his presidency. It was disbanded. And that means now we're talking about policies, we're talking about politics, we're talking about sustainability, we're talking about stakeholders, we're talking about key players, we're talking about your votes counting, asking people what they stand for. Because the pandemic preparedness and response is beyond the MDs present in this room. We're talking about the interagency preparation and collaboration. We're talking about having stockpile. We're talking about building a system. What most of us can do in this room right now is that we will render services. My brother Marcus will pray for us to take care of the soul, to give me strength to take care of the body. Like The other colleagues will take care of the body, but we will not do it in isolation. We have to still do it in a system. And the system right now, we don't have the fabrics and the building block. Now, on the good news is that Hurricane Ida made landfall in New Orleans, in Louisiana. And thank goodness, it was not as catastrophic as what we had in Katrina, because the levees worked. But meanwhile, in some parts of New Orleans, we still have an overflow, not a break, just an overflow. Because what was supposed to be 7 years extended to 13 years, and now it's a 30-year project. Then it will just fall off the radar because there is no system. For services, oh, we have amazing people. Does it hurt? Yes, let's cut it off. But it's the system that can help to build sustainability, and adopting a public health approach, I personally feel will be the key, sentinel side, surveillance, continuous and ongoing monitoring. When I was working for the World Health Organization, in my last assignment, I was a regional monitoring officer in the Africa Regional Office. My portfolio covered 47 countries for the end-stage polio program. What did we find there? Any polio we found in the entire continent, very few countries, we could trace them back to Nigeria. Not only to Nigeria, to specific side, Northeast Nigeria. What is common in Northeast Nigeria with what we had, the indigenous polio in Pakistan, the tribal area in Afghanistan? Conflict zones. People are not getting their shots.
Yes.
So you could just have a map of the white polio virus, conflict areas, and you see about these failed, fragile, and transition zones. They are the building block for the chaos. They are hibernating, and we just don't know. In the concept of global health, they sneeze in one part to catch a cold in the other part. The birds fly, the rodents go in the ship with us. So are we ready? No, because right now we're in the emergency mode. There's no clear post-emergency phase. We are not even looking at early recovery. We just want to get it done, because right now, apart from lives being lost, it's just inconvenient. We want to get it done as soon as possible. But the building blocks and fabrics are not there. And this is going back to like an epidemiology 101, our public health 101. I mean, it's like all the doctors here know. I teach preventive and social medicine. This is the same thing I tell my students. Then I'm faced with it, and I'm waiting for one of my students to ask me, hey, Doc G, then what are you doing about it?
Yeah. Yes. Yes. Dr. Zarif, you're on mute.
Yes, would you refresh the question?
Yes. Do you think we can get ahead of the next pandemic? We know that Barack Obama, just as Dr. Orkaja said, President George Bush, President Barack Obama, they warned the nation. They warned people about the pandemic. Can we get ahead of the next one? Is there going to be another one? Can we get past this? Dr. Carlisle, she's shaking her head yes. And all of you doctors agree, obviously. How do we get this nation healthy? Dr. Zarif.
I think that global healing happens on a local level. I think that's the beginning, and we have to go into these communities. Just like, I forget who said it earlier, but I know Dr. Farmington, right?
Harrington.
Dr. Harrington said something about, you said something about a young lady named Gina, and Gina, with her participation, how she reduced the amount of sick people, or she improved the readings, yes. Whatever that was, she did it on her own, right? Yeah, so I think that this global thing that we're looking at has to be done on a local level, all the way down to the individual. Again, I don't think that if there isn't any personal acuity, then there won't be any change. It will just be a repeat of what we've been going through. If you get a patient that comes in and you give them something for a headache, but then they go back home and do the same thing that got them the headache in the first place, the headache is going to repeat, and so on. So, I think that we have the answers because there's so many brilliant people in the community. There's so many, we have, brilliant doctors, brilliant attorneys. We have all of that, except it is not being used correctly for the betterment of people. It's more on an individual basis. Yeah. So if we can get that unity and a better unity for a better community vibe, I think that we can do better on a local basis, and then that will be infused into our picture of the global resolution.
Dr. Carlisle?
I think another pandemic is inevitable unless particularly if we fail to aggressively manage and control the one we're in the middle of. Mm-hmm. And that would be number one. There's a pandemic with COVID, and that occupies a fair amount of my time and psychic energy. But there's also an epidemic where, although we have the most expensive healthcare system on the planet, people are not empowered and educated to do self-care. And so we need to radically improve individuals' ability to do self-care and healthy living. And we need to, and the failure to do that is going to create a different kind of pandemic, obesity, metabolic syndrome, cardiovascular disease, etc. And so we're facing two big issues. Now, everybody in the sound of my voice can try to read more and learn about how to do better self-care. That's what everybody needs to do tonight before they go to sleep, is find some reputable resources on self-care, and healthy living, exercise, stress reduction, all that other good stuff. And then we really need to decide, how are we as a society going to do our share to control this COVID virus? Yeah. We as Americans love to bloviate about our individualism and freedom. It's not working too well right now. And so what are we going, now that, other countries don't want us to come because we're walking disease vectors, what are we going to do to try to get through to the new normal, the new effective, safe, reasonable, we can live with normal? I don't think we're going to go back to October 1919. I'm just saying. And maybe we will, but until that time, we all need to do what we can do to get us to the new normal.
Yeah, and we don't know what the new normal is. We have no idea what the new normal is. Now, I have made my predictions. And I'd like to know what your predictions are. Do you think we're headed for another lockdown sometime soon? Dr. Orke, yes or no?
Please repeat the question again.
Do you think we're headed for another lockdown? Yes or no?
We are fast approaching it, but we will not have a lockdown. It is very inconvenient. And politics and economics will truncate health.
Okay, that's the reason we're in the condition that we're in now, because it's so inconvenient for so many people.
That is also why we are having a recall election right now.
Okay, but he's not the reason. Gavin Newsom is not the reason. And I'm talking about a recall. I'm not talking about a recall just in California. We've got idiots all over the country. Look at Abbott. Look at Abbott, the biggest idiot on the planet. I think he's a total retard. And the schools in Texas are closing down. They're closing down. So where we're headed, Dr. Harrington might know. Dr. Harrington?
I keep getting muted. I figured you didn't want to hear what I had to say. I'm babbling away.
It's me, Dr. Sorry.
It's okay. I missed the guitars, Kenny. I wish the guitars.
That's it.
Look, I have no idea. I'm a little concerned about lockdowns. I'm more concerned about people practicing good habits like masking and hand washing than I am lockdowns. I think that emotionally it's been traumatic for the kids in particular. And, and unfortunately, I'm probably the wrong person to ask, because when I was a kid, when somebody got chicken pox, we'd all go over to their house in hopes of getting chicken pox so that we were over it. You know what I mean? And now we don't do that. But I think that there are better things now. I think there clearly are proven evidence-based therapies that are helping for these things. But you heard me say earlier, prevention is better than anything. It just
that's
is.
right.
And
Right.
what Dr. Carlisle said is get some good sources of information. The best healthcare systems do not solely rely on the providers. They educate the public. They teach them how to do things. They give people a sense of responsibility for their own health, which is something that we have neglected to do. So I think my preference would be on educating people with fact-based information and not, look, I fell for one of these things that was, the internet is terrible in many ways, but it's also potentially one of the best tools we have for educating people. There was a story about the CDC being a charity and making $4.6 billion a year in vaccines. And when I researched it, after I babbled about it on some interview, it turns out that that's not true. They do have a 501c3 foundation and people can donate to it and that money goes to the CDC. But they actually gave out $4.6 billion worth of free vaccine to people who couldn't afford it. So that's the type of misinformation that's out there. And it's so hard to sort some of that out. You really have to verify it, and that's where I think our most of our people in the United States are not getting good information because there's no cohesive clearinghouse. There's no source that you can go to that you can completely trust. And you don't know whether it's politics or somebody trying to get a paper published or what. But at the end of the day, the things that I heard today, which are make sure that you have a good diet, make sure that you lead a reasonably good lifestyle, that you eat healthy foods, that you boost your immune system with things that are proven, and that you practice careful behavior around other people. Those are tried and true. Can't argue with that. So
Right. Dr. Carlisle, are we headed for another? Not that the question. Do you think we're going to go into another lockdown?
Well, I think we're not going to. I think I agree with Dr. Harrington that lockdown has political and economic consequences that people are unwilling to endure. But I think failure to control COVID is having significant consequences that people are to recognize.
Yes.
And so, if we had done our share as a large country with a lot of money and resources, I can't expect Cuba to do the same kind of heavy lifting that we can do, and some other countries. But we definitely have not done our share to mitigate and to bend the trend.
Yes.
And although we may not have a lockdown, do I suspect we will have another surge? Oh, yes. So I think I would say I really think another surge is highly likely.
Okay.
And I think it's because if you look and see, are people masking up everywhere you go?
No.
Okay, so what do we think is going to happen?
Exactly. Yeah.
Is the virus going to go on vacation to Hawaii and just chill by the beach and let us run amok? No.
Yeah,
So
exactly.
I think another surge is inevitable. And I think a real conversation of, well, what are the costs that we're willing, my parents were part of World War II. So that's the generation, the greatest generation. People survived the bombing of London.
Yes.
People to war, in India, China, like my dad. And folks are getting all lathered up about a mask. We can't even inconvenience ourselves.
Yeah,
After
that's hard.
500,000 Americans have died. And I think
right.
that's something that is a reflection on our values and our cultural.
Absolutely.
So I suspect we won't have another lockdown. I do suspect we'll have another surge.
Dr. Zarif.
Yeah, I agree with Dr. Carlisle. I think it's about for United States is about monetization. It's like if you can monetize lockup, there's going to be a lockup. If you can monetize whatever you can monetize, that's what's going to happen. This is United States. Like when we talk about it, sometimes we want to be patriotic and I'm American. Yeah, I can feel that too. But when it comes down to it, war is good business. Yeah. All of this craziness that's happening now with the COVID, they'll find a way. I bet you once they maximize the monetization, we'll move on to something else. That's America. I've never known it to be any different than that. And I've been disenfranchised just like the next person. And it's no surprise that our future, unless we change it, is going to stay the same because after all, status quo gets you paid.
Yeah, absolutely. Well, you're right. All of you doctors are fabulous. We're out of time, unfortunately. We haven't solved it yet, but I think we're close to solving this. And for those of you that want to know about WGU, that's called Walgreens University. It's been enough time there. Okay. So thank you so very, very much for being a part of this broadcast, because it is time to tell the truth. And thank you very much for being with us. Thank you, everyone in the audience. We still have a lot to talk about, so we're not finished. It's always time to tell the truth. Thank you, Dr. Carlisle. Thank you, Dr. Harrington. Thank you, Dr. Zarif. Thank you, Dr. Orkay. Thank you, Marcus Banks Bay, for all of your kind words and your prayer and your thoughtfulness. Thank you very much. Thank you, everyone in the audience. This has been wonderful. Don't forget, tomorrow is In the Mix, Conversations with Colette and Corliss, and be right here on the Intentional Talk Radio Network. And I will be contacting all of you doctors. We've got the Southern California Women's Health Conference coming up November 12th. We need your input again. So thank you very much. This has been awesome. Dr. Harrington, we want you to talk about the antibodies in Pasadena. Thank you so much, everybody. Have a good night. Does anybody need help walking to your car?
Okay. Appreciate the invite back.
Okay, take care, everybody. Have a good night. Thank you very much. Take care.